Hello everyone, this is Atina Razzaque and I will be talking about my summer research project which was about the development and validation of an extraction protocol to measure 5-fluorouracil, a chemotherapeutic drug for treating colorectal cancer. Colorectal cancer is the third most common cancer in Canada. 5-fluorouracil has been a vital component of treatment for years. Despite treatment advancements, 20 to 30% of patients still suffer severe side effects, leading to hospitalization. Approximately 8,000 new patients receive 5-fluorouracil annually, with 2,400 experiencing toxic effects. Our current dosing is based on body surface area, which leads to under or overdosing. The project aimed to create a liquid chromatography tandem mass spectrometry based assay for extracting 5-fluorouracil, dihydrofluorouracil, uracil, and dihydrouracil from colorectal cancer patients' plasma. Successful validation of a method could pave the way for clinical implementation in CRC patient care. Through this assay, the feasibility of conducting therapeutic drug monitoring for 5-fluorouracil to enhance optimal dosing during chemotherapy could be assessed. Understanding the metabolism of the drug was the initial step in devising an extraction method. Identifying reasons for increased toxicity in patient blood samples was crucial. One common cause was the inadequacy of the endogenous enzyme dihydropyrimidine dehydrogenase (DPYD). This enzyme catalyzes 5-fluorouracil into its inactive metabolite, dihydrofluorouracil. While DPYD deficiency is rare, it can affect 3 to 5% of cancer patients due to genetic variations or gene expression mutations. BSA treatment refers to dosing chemotherapy drugs that takes into account a person's height and weight and is used to estimate the body surface area. The problems with the current treatment are as follows: variability in drug response, under or overdosing, not taking genetic variability into account. The alternate treatment can be done using the area under the curve, which is considered effective for several reasons, such as it takes into account individual variability by minimizing toxicity and maximizing efficacy. We have tried three different extraction methods, which were protein precipitation, liquid-liquid, and dried blood spots card extraction, with five different solvers for this experiment. And protein precipitation showed us the most promising results. The initial challenge was establishing the detection limit for our Agilent 6410 mass spectrometer. Patient samples often contained uracil and dihydrouracil concentrations below our detection limit, causing asymmetrical curves. In contrast, 5-fluorouracil and dihydrouracil displayed consistent retention times with Gaussian curves, which means symmetrical curves. We determined the detection limits for all analytes and constructed a calibration curve using 7 different calibrators to quantify them in patient samples. The next obstacle was 5-fluorouracil having a very short half-life, which causes it to break down very quickly. This means by the time the blood was collected and the plasma was extracted, some of the 5-fluorouracil had been already broken down. Hence, we tried another method which is fairly very new and only one paper has been published on it. We tried to extract 5-fluorouracil and dihydrofluorouracil from the whole blood. The idea was to compare the venous concentration of these analytes with capillary blood concentration. A few blood samples were spiked with the desired analytes, and the DBS card was spotted using a pipette of 50 microliters of spiked blood. It was allowed to dry for 3 to 4 hours, and the protocols for protein precipitation was carried out. But unfortunately, first experiment was not what we had expected it to be due to the mismatch of our starting conditions of chromatography. And this encouraged us to optimize our own steps, which has never been used in any of the extraction protocols before, and we got consistent results for both the analytes. A calibration curve was constructed in order to validate the method. Previously, we thought to collect blood after 46 hours of their first chemotherapy session, but a new approach can be proposed where patients will now collect their own blood samples using the DBS cards. Some of the advantages of this approach are self-sampling, pre-dose blood work benefits, reduced toxicity, and improved safety. So we are hopeful that this method will be a new way to combat CRC and bring positive impacts on the health sectors of Alberta. A few journals which have guided us in our own experiment. Thank you for listening.